Ever wondered how life can surprise us? Picture someone with a hectic job, always on the go, suddenly facing something unexpected. What if, amidst the busyness, they find something unusual, sparking worry? Let's explore a story where life's surprises meet human strength. Can a busy person find comfort in uncertainty? Stay tuned to discover the twists and turns, and learn the importance of self-care in the midst of a bustling life. In the midst of her busy life as a hard-working sales manager, Kara, always on the road, found herself caught up in the whirlwind of work. One day, during a routine shower, she discovered a lump in her right breast. Worry crept in immediately, especially because her aunt had fought and conquered breast cancer. The fear of history repeating itself weighed heavily on Kara's mind. Taking a proactive step, Kara promptly visited her general practitioner, GP. Recognizing the seriousness of the situation, the GP referred Kara to a breast surgeon for a more detailed assessment. The term breast surgeon brought a mix of anxiety and anticipation, but Kara understood the necessity. In the breast surgeon's office, amidst medical charts and the clinical sun of the surroundings, Kara underwent a series of examinations. The breast surgeon, with a reassuring demeanor, conducted an ultrasound to delve deeper into the nature of the lump. The room held a palpable tension as Kara braced herself for the unknown. The breast surgeon recommended a triple test, a comprehensive diagnostic procedure involving imaging, biopsy, and other examinations. The days that followed were filled with emotional ups and downs for Kara, marked by anxiety and sleepless nights. Finally, the results arrived, and with a mixture of trepidation and hope, Kara met with the breast surgeon. The tension in the room lifted as the doctor delivered the news she had been desperately hoping for. The lump was a fibroadenoma. A fibroadenoma is a non-cancerous, benign, breast lump. This smooth, round, solid tumor consists of fibrous tissue and glandular tissue that form a mass. In very rare cases, a fibroadenoma may contain breast cancer. Fibroadenomas often shrink or go away without treatment. Your healthcare provider may watch a fibroadenoma over time to see how it changes or recommend surgery to remove it. There are two main types of fibroadenomas. Simple fibroadenomas are the most common. They tend to be smaller. These lumps don't increase your breast cancer risk. Under a microscope, the biopsied tissue appears uniform, the cells look the same all over. Complex fibroadenomas are more common in people over 35 and tend to be larger. Under a microscope, your provider may find some differences in the cells. They're not uniform like a simple fibroadenoma. Your provider may also see calcifications or cysts on your mammogram. They may increase your risk for breast cancer slightly when compared to that of people with no breast lumps. Complex fibroadenomas occur about 15% of the time. Other types of fibroadenomas include giant fibroadenomas, which are fibroadenomas that grow to be larger than 5 centimeters, cm. Juvenile fibroadenoma, a fibroadenoma that occurs in children and teenagers between the ages of 10 and 18. Benign breast lumps, including fibroadenomas, are common. A fibroadenoma is the most common type of benign breast lump. They happen most often when you're between ages 15 and 35. Fibroadenomas are solid lumps, not filled with fluid, in one or both breasts. They aren't painful and move easily under your skin if you push them around your breast. They can be as small as a pea or grow as large as a golf ball. About 2 to 3 centimeters is typical. A fibroadenoma can be round or oval with clear borders. Smooth, firm or rubbery. You may notice it becomes tender in the few days just before the start of your period. Large fibroadenomas are more likely to cause pain than small fibroadenomas. Fibroadenomas tend to grow very slowly, but they don't always get bigger and may even shrink. This is especially true if you're in your teens or have reached menopause. Conversely, a fibroadenoma may grow larger during pregnancy. Healthcare providers don't know why some people get fibroadenomas. Some believe it has to do with being sensitive to estrogen. This is because fibroadenomas tend to grow during pregnancy or hormone therapy, when estrogen is higher, while they're more likely to shrink after menopause, when estrogen is lower. Fibroadenomas grow in the lobule area of your breast tissue. Lobules are the glands in your breasts that make milk during lactation. Fibroadenoma is most common between the ages of 15 and 35. However, anyone who has a period, menstruates, can get them. Once you reach menopause, they become uncommon. Black people have a slightly higher risk of developing a fibroadenoma. Most fibroadenomas aren't life-threatening or cancerous. But they can get bigger, change in appearance, or become painful. Like most breast diseases, regular breast exams or mammograms are the best way to prevent complications. While breast disease is often unavoidable, your risk for complications from these diseases decreases with early detection. Contact your healthcare provider anytime you notice a breast lump or breast changes. Some fibroadenomas are too small to notice. If you or your healthcare provider finds a lump, your provider may perform these tests to determine what type of lump you have, imaging scans, including mammogram and ultrasound. Image-guided core needle breast biopsy. This test involves removing a sample of the fibroadenoma and sending it to a lab for analysis. Some fibroadenomas shrink in size or disappear without treatment. If a biopsy confirms the lump isn't cancerous, your healthcare provider may recommend follow-up appointments to monitor the lump for any changes, usually in 3 to 6 months. This could involve manual breast exams, ultrasound, or mammogram. Sometimes, a provider recommends surgery to remove a fibroadenoma. This happens when they're concerned about the results of your imaging tests or biopsy, or if the lump causes pain. Surgery is sometimes necessary for very large fibroadenomas. The most common procedure to remove a fibroadenoma is a surgical excision, cutting the lump out. Another option involves freezing the fibroadenoma in a procedure called cryoablation. Yes, it's possible to get more than one fibroadenoma. That's why it's important to become familiar with how your breasts typically feel. You should alert your healthcare provider to any new lumps in your breasts. Healthcare providers may recommend removing a fibroadenoma if it's large, painful, or suspicious. However, this isn't always the case. Many fibroadenomas shrink or go away without treatment. In the case of a small, unsuspicious fibroadenoma, nothing happens if it goes untreated. Your healthcare provider is the best person to decide if removing a fibroadenoma is necessary or if monitoring it for changes is a better route. Be sure to ask your provider any questions you have so you understand your treatment plan. Unfortunately, you can't do anything to lower your risk of fibroadenomas. However, you can take these steps to reduce breast cancer risk. Perform regular breast self-exams. Visit your primary care provider or gynecologist each year for clinical breast examinations. Get regular mammogram screenings, starting at age 40, but earlier if you're high risk. Don't drink alcohol. Don't smoke cigarettes. Eat plenty of fruits and vegetables and exercise regularly. Maintain a weight that's healthy for you. Most people with fibroadenomas or benign breast disease don't develop breast cancer. Still, you should follow the recommended screening schedule set forth by your provider and report any changes in your breasts. It's rare for fibroadenomas to turn into cancer. However, you should continue to check the tissue in your breast for new lumps or changes to existing lumps. Becoming aware of how your breasts feel is the best way to recognize changes that could be worrisome. When should I worry about a fibroadenoma? Try not to worry about a fibroadenoma. They're rarely cancerous and most can be left alone. Getting a fibroadenoma rarely increases your risk for cancer. However, you should follow your provider's recommendations on breast cancer screenings just to make sure. When should I call a healthcare provider about a fibroadenoma? You should call your healthcare provider if you experience a breast lump that changes or gets bigger. Painful lumps. A newly discovered breast lump. Nipple discharge or rash. The revelation brought immense relief, a fibroadenoma, a non-cancerous entity. The weight lifted from Kara's shoulders, and a newfound appreciation for life settled in. This transformative experience became a catalyst for positive change, emphasizing the significance of self-care amid life's demands. Kara's story is not just hers, it resonates with anyone navigating the complexities of a busy life. It underscores the importance of heeding the signals our bodies send, prioritizing health, and confronting fears with courage. As we bid farewell to Kara's narrative, let it be a reminder that within the ordinary moments lie extraordinary lessons. Subscribe to stay connected with stories that unravel the profound insights life has to offer. The journey continues, and we invite you to be a part of it. Subscribe now, and let's explore the intricate tapestry of life together.